Aspirating a knee joint is a common procedure and a common skill that's required for when you're on call. Knee joint is probably the most commonest joint that you'll be called to assess to rule out aseptic arthritis, and therefore today's practical will be based on this. Before the start of any procedure, the key thing is to be ready with all of the stuff that's required, and we'll just show you essentially the equipment that is required for this. The two main complications really that you can cause with this procedure is causing pain and distress to the patient and introducing an infection in an otherwise non-infected joint. So clear communication with the patient, explain what you're planning to do, and I find it helpful always to have someone present, either another member of your team or a nursing staff, so that they can be there as a provide calming reassurance to the patient, or if you drop anything on the floor, they can peel off and go and get it for you. So always try to have two people doing this procedure. It is a strict non-touch aseptic procedure, and therefore once you feel for your landmarks, avoid the temptation of wanting to have a feel again before the needle goes in. So with regards to the landmarks, is a similar area that you would do steroid knee injections that you would do in your elective clinic, and essentially it's the suprapatellar landmark just beneath, a centimeter beneath the patella, in that soft spot over there. It's quite helpful, I find, with your opposite index finger to feel where that soft spot is on the other side, because that will give you a level, once you've already prepped the area, of where to aim for. And also by putting a slight downward pressure on your index finger on the opposite side, that will help tilt the patella upwards and create a bit more space for the needle to go in. One of the common difficulties is encountering bone when a needle is first advanced, and that is often because it's hitting against the condyle of the lateral femur, and by just withdrawing it slightly and dropping your hand and then advancing it, you get between the space of the patella and trochlea. So obviously, with this being a model, I'm not going to prep, but if you just imagine this is a prep, once the spot is identified, you can put a gentle impression with your finger, but then essentially prep the area, moving outwards as per basic principles. And once the area is prepped, avoid the temptation, as I mentioned earlier, to have a feel again for your landmark, because you know that you're trying to reduce the chances of introducing infection, and this is a strict aseptic non-touch technique procedure. Okay, you can go for it. Slowly advancing, you feel a puncture as it goes through the capsule, and then you kind of, now as I've not dropped my hand enough, I'm hitting bone, and if you just withdraw it and do that, you're essentially within the space. And then get your fluid, and if there is a large effusion, leave the needle in place, empty it, and always aspirate it to dryness, because you don't know when you may, if it is an infection, when you may get the opportunity to take the patient to theatre. So by aspirating the dryness, not only would be more comfortable for the patient, but also reduce the infective load and buys you some time. So always aspirate to dryness. And once the procedure is done, obviously, slowly get the needle out, and get your assistant essentially to help you with the next bit, opening the universal container and putting 2 new needles every time you put a sample in the blood culture bottles, wiping the top, of course, before putting the sample in. Thanks for watching this video, and again, it's a simple technique, but it's an essential one to be familiar with for when you're on call, and to avoid the 2 complications, which is causing pain and distress, and infection. Just requires clear communication with the patient and strict kind of aseptic precaution.